This is the opensource.club, a free St. Louis-focused knowledge share podcast. Through industry experts, entrepreneurs, personal stories, and more, we provide the information you need to achieve and thrive. Always visit our website, theopensource.club, for more details. Contact us on Facebook, Twitter, or LinkedIn.
A gynecological exam is a necessary part of women's health maintenance. During an exam, doctors screen for diseases based on age and risk factors. A gynecological exam is the first point of contact for detecting any abnormalities with reproductive organs and other areas of the body. Yearly visits help your physician detect issues and possibly avoid complications. Without an exam, a precancerous lesion will go untreated. Undiagnosed sexually transmitted infections can lead to serious pelvic infection that could even cause infertility. Gynecological exams benefit a woman's overall health. Detection of high blood pressure or diabetes is possible and can be treated. But going to the GYN isn't just to treat potential illnesses. It's also a time to talk about how to maintain a healthy lifestyle and minimize health risks. I'm your host, Ruthie Zell, and this is Healthy You by the Open Source. This episode is sponsored by Planned Parenthood, a trusted healthcare provider and educator.
You're listening to Healthy You by the Open Source. Become a subscriber and hear all our shows. Go to www.theopensource.club and insert your email address in the podcast subscription window.
My guest today on Healthy You is Planned Parenthood's Associate Medical Director, Dr. Margaret Baum. Welcome, Dr. Baum.
Thank you.
Dr. Baum, you have an extensive medical background. What is the scope of your work at Planned Parenthood?
Well, thank you, Ruth. I have been a gynecologic provider in the St. Louis area for the past 15 years, and I'm very excited to start my new role as the Associate Medical Director at Planned Parenthood. So in this role, I provide a number of services to both women and men in the St. Louis and Metro St. Louis area. So first, I am an abortion provider. That is a large part of what Planned Parenthood does, and I do provide those services to women both in Missouri and Illinois. I am also a referral surgeon, so we have a surgical practice here at Planned Parenthood providing both some in-clinic procedures as well as procedures that are done at local hospitals. And then my other role is as the Associate Medical Director, in which I work closely with our medical director and our other providers here at Planned Parenthood to guide policies and practices to provide accessible and excellent care to both women and men in this area.
So Planned Parenthood has an advanced GYN program, but in the past it was a limited service. So why have you expanded that and added more doctors?
So in the past, our medical director was a part-time position, and that physician had other duties, and so there really wasn't the opportunity to expand these services. We now have two full-time physicians, and so we want to expand access to more advanced services for our patients. Before, patients who required these services often had to be referred out to other facilities or other providers when they needed procedures, but now we can provide them here. So this gives great continuity of care for our patients because Planned Parenthood is and strives to be a safe space for our patients and help them feel more comfortable for continuing to get their care with us, and so hopefully providing more access and allowing patients to come in and get the care that they need.
Could you elaborate on what services Planned Parenthood's advanced GYN program provides?
Yes. So this will not be an exhaustive list because there's many things we can do, but one of the main services that we will provide will be treatment and diagnosis for abnormal pap smears and precancerous lesions of the cervix. So when someone gets a pap smear, that's a screening test for cancer and precancer of the cervix, and when an abnormality is detected, often further evaluation and treatment is needed. And so those services, both again for evaluation and treatment of the precancerous lesions to prevent progression to cancer, can be done in our facilities. We also take care of complex problems of the vagina and vulva, so the skin of the outside of the female genitals. We provide hysteroscopy, which is a procedure in which we're able to view the inside of the uterus using a small camera and fluid. We can often take out problematic lesions for women, and that can be done in the office. We can do evaluation and treatment for more advanced gynecologic problems, so pelvic pain, some initial treatment and evaluation of infertility. We provide ultrasound evaluation of women's organs. And then myself and Dr. McNicholas, my partner, are both surgeons, so we also provide surgical services. Those would be done at our local hospital, so that would include sterilization, needed surgery on the ovaries, the uterus, hysterectomy, and other procedures.
So let's talk for a moment about the gender-affirming hormone therapy you offer. That's for our LGBTQ community. Are they aware of this service?
Well, certainly Planned Parenthood has always been a trusted provider for this community, and so we certainly hope so. We will, as we begin to expand our services, there will be more marketing so that hopefully more people become become aware of what we're offering.
How long have you been providing that treatment?
It's been about a year in which we've started to provide some therapy on a smaller scale, but in the future we are hoping to involve more clinicians and make these appointments and these treatments more accessible to patients.
Tell me everything that a person should know in considering that kind of treatment if they feel that might be the right thing for them.
Sure. So I think the most important thing to know is that Planned Parenthood is a safe space for all patients. That includes patients that are coming for any type of care, but also specifically including those seeking gender-affirming hormone therapy. We want them to know that they will receive appropriate, sensitive, and respectful care. So it's a little bit hard to talk about in broad strokes because gender-affirming hormone therapy can mean a lot of things to different patients. It can mean lifestyle modifications. It can mean medications. It can mean legal changes. It can mean surgery or some combination of any or all of those things. So what we want patients to know is that when they come to Planned Parenthood, they will receive a comprehensive evaluation and assessment of their needs and an individualized treatment plan.
Now, I recently learned Planned Parenthood performs vasectomies. Are men aware of that?
I hope so. There are a number of places that you can receive vasectomy care, but Planned Parenthood is really very convenient, and appointments are available.
So what is the appointment process? How do they get one?
So it's really very straightforward. So patients seeking a vasectomy can call our appointment line or actually go online to schedule an appointment. You do need to have a first consultation to discuss the procedure and make sure that that's actually the right procedure that you're seeking. But that actually can be done these days by telehealth, and then the second appointment after that is the procedure itself.
So what kind of cost are we talking about here?
Well, often vasectomy is covered by insurance, and Planned Parenthood does take most insurance, commercial and public insurance plans. So oftentimes there wouldn't be any cost to the patient. But if patients are uninsured and they are seeking a vasectomy, we do provide those procedures based on a sliding scale, based on the patient's income. And the typical fees range between $350 to $700.
Is it possible if someone gets this procedure and, years and years later decide, well, maybe I shouldn't have done that? Can you reverse vasectomies?
So we really hope that when patients get sterilization procedures, both male or female sterilization procedures, that they've thought really hard about it, discussed it with their family, and decided that this is the right thing for them because it is meant to be a permanent procedure. Now, there are options for fertility after a vasectomy, including in vitro fertilization, and there are some providers that provide vasectomy reversal. That is not something that Planned Parenthood does, but there are options sometimes in the future.
Okay. So what locations provide advanced gynecological care?
Well, right now, our two largest centers, which are in the Central West End, and then our newest center in Fairview Heights, is where we house the equipment required for these procedures.
Does a patient need a referral? And if so, who provides that?
Actually, happily, there are multiple ways to access our care. So you do not need a referral. If a patient knows that she needs a specific procedure or believes that she or he does, the easiest way to get an appointment is to call our appointment line or to go online. There may be some questions from our staff, and if they're not sure of where the appropriate place that the patient should be, they will contact myself or one of the other clinicians. But you certainly do not need a referral for these procedures. However, we do often get patients through referral. So we work with a number of clinicians here through Planned Parenthood who are seeing patients at all of our outlying sites, and they will refer patients to us. And then we certainly accept referrals from the community. We want everybody to know we provide these services. So if there are providers out in the community who have patients who need these things and they're not able to get them, we certainly welcome those patients at Planned Parenthood through a referral.
Okay, so you take patients, I understand, with and without insurance, but for those without insurance, what kind of costs are we talking about, and how do you work out the finances?
It's difficult because we're talking about a large range of different procedures that may range from, very minimal cost to more expensive procedures requiring more physician time or more equipment or more support. So it would certainly vary depending on what the procedure is and what the patient needs. Of course, if a patient has insurance, the insurance would be used first, and our staff can assist in helping people determine if services are covered. But a lack of health insurance should really not be a deterrent for seeking care. So Planned Parenthood provides sliding scale fees based on income to uninsured patients. And our call center staff is happy to talk to patients about this, and we'll tell them what sort of documentation needs to be brought in so that we can help them get the care that they need in a way that they can afford.
And for our younger listeners, what's the minimum age for someone to take advantage of the service?
So there really isn't a minimal age. We see patients really, at all ages when they present with the type of problem that we can take care of. So for a gynecologic problem, we see all ages. There's no upper or lower limit of age. Certainly for sterilization procedures, we're going to see patients, not pediatric patients. But if the question arises, if somebody can be seen, the best answer is to just call the health center, and they can connect to us, and we can decide if this is the best place for their care.
Dr. Margaret Baum, Associate Medical Director at Planned Parenthood, thank you so much for joining us today.
Thank you.
Gynecological exams are critically important for women's health. With the expansion of Planned Parenthood's advanced GYN service, there are now more affordable opportunities for women to get the health care they need. As an inclusive provider of health, Planned Parenthood is there for the LGBTQ community as well as all men. Planned Parenthood has 8 physical locations in Missouri. For more information, go to PlannedParenthood.org. My thanks to Dr. Baum for being a guest on Healthy You by the Open Source. I'm your host, Ruth Ezel.
Thank you for listening to the OpenSource.Club podcast. Become a subscriber through RSS or YouTube. There's more to come that you won't want to miss. Our name is our web address, theopensource.club.